Welcome, pool guys and gals, to the Let's Talk About Pools podcast, where your host, Lauren Broom, will take a splash into many topics in the pool industry to educate all aquatic professionals. Listen in, and you just might be surprised what you'll learn. So let's jump right in.
Welcome to the Let's Talk About Pools podcast. And in season 2, episode 36, I had the great honor of interviewing Chris Edens and Michelle Hlavsa, both from the Centers for Disease Control, CDC, and the Healthy Swimming section. Chris Edens is a specialist on Legionella, and Michelle Hlavsa is a specialist on Cryptosporidium, or also known as crypto. And we talked at length about Cryptosporidium and Legionella. I'm going back to my roots from my experience at the local county health department here in Florida. So I really enjoyed this episode. And if you really want to learn about these two recreational water illnesses, I highly encourage you to listen to this episode today, because the Cryptosporidium and Legionella, we're seeing more and more cases nationwide, and they are the experts here from our nationwide public health agency. So I hope you enjoy this episode. And I also wanted to say thank you to my main podcast sponsor again, which is Skimmer. Thank you so much for your continued support. And my new podcast sponsor today, which is RayPack. Thank you so much. And listen in the middle of our episode here on what RayPack has to offer for the pool industry. And thank you both of my sponsors, Skimmer and RayPack, for your continued support of the podcast and for continuing education. So let's jump right in, guys.
This is Skimmer, software for the modern pool professional. What can you do with Skimmer? See all your customers on a map, build service routes quickly, and let Skimmer optimize them for you. Access customer information, including contact details and full service history, anytime and anywhere. Customize work orders to track jobs like repairs and filter cleanings. Email your customers when you complete a service. You can include service details and on-site photos. Does your customer need a part? Add it to the shopping list and track it from purchase to installation. Skimmer will even remind you what parts you need for the day, and you can mark them as installed right when you're finished. Skimmer doesn't just store your service history, it helps you get paid. We integrate with QuickBooks Online for fast, easy invoicing. And we've got more billing options coming soon. All that's just the beginning. Go to getskimmer.com to watch our demo video, check out our online tutorials, and see if Skimmer is right for you.
Welcome to the Let's Talk About Pools podcast today. And on my podcast episode today, I have some very awesome podcast guests that I've been really excited to have on. Just because of my background in public health that all of my listeners, I think, know about by now, that I had worked for a local health department for 17 years. And I also worked in epidemiology. So I'm so excited to have Michelle Hlavsa, she's the chief of CDC Healthy Swimming Pool Program. And also I have Chris Edens. He's epidemiologist over the CDC Legionella section. Welcome, guys. How are you?
Doing great. Great to be here.
And
thanks for having us.
No problem. You guys, I consider the experts in public health in these two particular. We're going to talk about Cryptosporidium today, and we're going to talk about Legionella. So I consider you being with the CDC, and we get all of us pool operators and everybody in the pool industry. We get our guidelines from you guys when it comes to how to treat fecal accidents, which largely revolves around Cryptosporidium. When we get into diarrheal incident response. So we could talk a little bit about that while we're here as well. So tell me a little bit about you, Michelle.
I'm here at CDC's Healthy Swimming Program, and what I'd like to do is promote healthy swimming, so reminding people not to swim with diarrhea and not swallowing the water we swim in. If you got to tell people not to swim with diarrhea, you definitely don't want to be swallowing that water.
Exactly. I totally agree with you. And tell us a little bit about you, Chris.
Yeah, I'm an epidemiologist on the Legionella team. As you mentioned, I've been doing this for 4 or 5 years now. And prior to that, I was an epidemic intelligence service officer in the healthcare infections group at CDC.
It's a very interesting organisms we're going to talk about today, both crypto and Legionella. So let's dive right into this. And we're going to get right into Cryptosporidium and with you, Michelle. So tell the audience, what is Cryptosporidium?
Cryptosporidium is a parasite that can cause frequent, non-bloody, watery diarrhea. It's not like diarrhea caused by viruses or bacteria. It lasts for days. It's not a one-day thing. It's not a few-hour thing. We're talking 3 or more days.
And they don't feel very well when they have that, do they?
No, people in general have a lot of diarrhea. We've seen reports of people reporting 40 plus episodes of diarrhea in a day sometimes. It's about abdominal cramps, it's fatigue, it's fever, vomiting, weight loss. Not a lot of fun.
It's not a pleasant thing to have. So this is why we're talking about it, right?
Yes, we definitely want our pool operators and our swimmers working together to prevent crypto from getting in our pools in the first place and then not spreading it if it is in the water.
So how is it spread in our aquatic facilities?
So if someone's infected with Cryptosporidium, they'll be experiencing diarrhea and they'll go swimming anyway. And, some people don't get super sick from diarrhea. They might have a swim meet they're really interested in, a pool party they want to go to, and they end up getting in the water thinking, oh, I'm not going to have diarrhea in the water. I mean, it's pretty obvious when you have an incident in the water. And so they go swimming, the infected swimmer goes swimming, and then other swimmers come around and whether they're close by or it's been a day later, they swallow the water that's been contaminated. Someone with Cryptosporidium can release tens of millions to hundreds of million Cryptosporidium oocysts, and these are the infectious life stage of Cryptosporidium. So this is what gets into people's intestines and causes all that diarrhea. And when somebody else swallows it, they themselves can become sick. And you only have to swallow 10 or fewer of these oocysts to get sick.
Is it just like they get a little bit of water on their lips and there's enough the oocysts on that water on their lips that they ingest that water that's enough? Or would it take more water than that to ingest to actually become ill?
Well, I'm going to guess it's going to take more than just getting water on lips. It's actually swallowing the water. Studies have shown that children under the age of 18 swallow 3 times as much water as adults do. And so they're swallowing more water, and we see higher reported rates of illness among young kids. And that might be because, the first time you get infected with Cryptosporidium, you're more likely to have symptoms. Later on, if you get reinfected, you're less likely to have symptoms.
Because you have some immunity to it for a certain period of time?
Exactly.
So can normal disinfection levels kill Cryptosporidium, Michelle?
So if we're talking about normal disinfection, we're talking possibly about 1 part per million. That's probably what most state and local governments require as a minimum disinfection, 1 part per million free chlorine. And so if we're talking that kind of concentration, we're talking about Cryptosporidium surviving for more than 7 days in the water. So those oocysts that cause infection that come out with the diarrhea into the water, they have a hard outer shell, and that protects them from chlorine. Most germs, we know that they would probably be killed or inactivated by that chlorine level within minutes, if not seconds.
Yep. And what's the highest level that it takes to kill Cryptosporidium? If say you had somebody who was in the water, there's a documented crypto case in the water, or you had a diarrheal incident, so they're not going to get tested, but you got to assume possibly that they might have crypto. So what should a pool operator do?
So if there's a diarrheal incident in the water, which we consider a high-risk Cryptosporidium contamination event, or if a pool is at least suspected to be associated with an outbreak caused by Cryptosporidium, we hyperchlorinate. And what that means basically is raising the chlorine level to 20 parts per million, keeping it there for almost 13 hours, 12.75 hours exactly, but keeping it at that level for extended period of time, and then bringing that chlorine level back down so that people can re-enter the water. And, this is a lot to ask for a pool operator to get that chlorine level up. We're basically keeping that level 1, 2, 3 parts per million in most pools, I would say. So to get that level up, to bring it back down, you're talking hours and hours on top of that 13 hours. So, with Cryptosporidium, that 13 hours at that really high concentration is what it's going to take to kill Cryptosporidium once it gets in the water. So it's really, really important to make sure our swimmers and parents of young swimmers know how to keep Cryptosporidium out of the water to begin with. And what that basically means is stay out of the water if you or your kid are sick with diarrhea. We shouldn't be swimming when we're sick with diarrhea.
Yep. Totally agree with you that. Thank you for bringing that up. And the reason for the diarrheal incidence with the 20 parts per million for the 12.75 hours, is that due to the hardest part of the life cycle that Cryptosporidium has to kill it?
Exactly. It's what it's going to take to get through that hard outer shell that these oocysts, this life stage that causes infections that comes out with the diarrhea. That's what it's going to take to get through that hard outer shell.
And just to reiterate, how much of this organism does it take to get sick again or to become ill? To set people
10 or fewer.
Yeah, it's not a lot, is it?
No, it's not a lot, especially if someone can, in one diarrheal incident, release tens of millions to hundreds of millions.
Now, I'm going to pose this as a situation. So if a health department is investigating, they have some crypto cases and they've notified the pool operator, say it's a public pool that they regulate, and they notify the pool operator in general, we've had some crypto cases that have used your swimming pool. Pool operator, of course, we've already said, should follow the CDC guidelines. If they do not, would they be negligent in future cases in an outbreak after that initial contact from their local health department?
So CDC makes recommendations. We're not a regulatory agency. That's really up to the state and local health departments. They're the ones that are regulating, and they will choose whether or not to use CDC recommendations. From what I'm hearing from our state and local public health partners in the state and local health departments is basically they are following CDC recommendations on this. The best thing a pool operator can do is try to get that crypto out of the water if there is a diarrheal incident in the water, if a pool is suspected to at least be linked to an outbreak caused by Cryptosporidium. It definitely is time to hyperchlorinate and, get that chlorine level up, keep it up for those 13 hours almost, and then bring it back down and allow the swimmers back in.
And it's great. I asked that question because I know a lot of pool operators get really scared about the negligence part when it comes to crypto outbreaks. This one makes them really nervous and they think that they're going to get in trouble. And it's nice to hear that the health agencies using the CDC guidelines, working with the pool operators and the swimming pool properties in order to work through and just get rid of the outbreak, I think is the ultimate goal, is what we're all trying to do together.
Yeah, we're partners. Public health or the health department and pool operators, we're partners along with the swimmers of promoting healthy and safe swimming. This isn't about an operator doing something wrong. This is about, trying to figure out, now that we know or at least suspect that there's crypto in the water, how are we going to kill it and activate it? How are we going to make sure that it's not going to infect any more people? When I think crypto, I'm not so worried about how well the pool is operated and managed. I mean, an outbreak caused by Cryptosporidium isn't necessarily an indication that there's poor operation and management. The best run pools could have crypto in them and be linked to an outbreak. I'm more worried if I hear about an outbreak caused by by germs that are more sensitive or susceptible to chlorine, like Legionella, which Chris will be talking about later, or like, E. coli or Shigella or Salmonella or Norovirus, then I'm worried about what's going on with operation and management. That tells me there's not enough chlorine in the pool. That tells me, or hot tub or whatever the water body is, there's something going on with the operation and management.
And that's exactly why I asked the question, because I wanted them to hear from you guys that it is about working together, especially with crypto, because exactly, I didn't want to say, I wanted you to say that crypto is not about how they operate their facility, because the best facility could have a crypto outbreak. So what you have to do is learn how to identify it, or once it's identified to them, what they need to do in order to get it out of the water and stop the outbreak moving forward.
Established in 1947 and part of the Broom family of brands since 1985, Raypak is a globally recognized and trusted name in the heating industry. We manufacture high-efficiency boilers, water heaters, and pool and spa heaters for commercial and residential applications at our Oxnard, California headquarters. With over 450 dedicated and passionate team members and 150,000 square feet of manufacturing space, we're always working to provide innovative solutions that meet our customers' high standards for quality while maximizing performance and reliability. Our state-of-the-art Innovation Learning Center serves as a training hub and collaborative space for engineers, representatives, wholesalers, and contractors. The ILC is equipped with the latest digital technology, a large lecture room, and a live demonstration and instruction lab for hands-on learning, so you get the most out of your training experience. We understand the importance of comfort while you learn. That's why our ILC features an inviting customer lounge and break area with interactive product displays where you can learn about our full product lineup. The ILC is the perfect setting to learn everything you need to know about Raypak products. As a member of the Broom family of brands, Raypak is committed to Broom manufacturing sustainability goals and taking a greater degree of responsibility for future generations. By 2025, Broom will reduce greenhouse gas emissions by 50% and achieve zero waste landfill for global manufacturing operations. At Raypak, we demonstrate our commitment to sustainability throughout our company and our value chain, from innovative, sustainable product development to our proactive and responsible manufacturing processes. Every member of our team practices sustainability every day, because we've seen how small differences can make a big impact. Our products are designed and manufactured in the USA at our Oxnard headquarters. Our manufacturing facility features cutting-edge automation technology and robotics to ensure precise, controlled production of our boilers, water heaters, and pool and spa heaters. At the end of the assembly line, we test every unit and document quality checkpoints to ensure safe and reliable performance before shipping products to our customers. Our innovative solutions, designed by our team of engineers, are built, tested, and perfected in our engineering lab prior to manufacturing. In 2018, we completed a multi-million-dollar renovation to double our lab size and increase our testing capability. Equipped with 17 test stations, an environmental ambient control room, a wind test machine, a burst test chamber, a 3D printer, and more, our engineering lab demonstrates our commitment to both innovation and quality assurance. Raypak's engineering team has filed over 35 patents since 2019 and continues to develop cutting-edge advancements in boiler and water heater technology every day. Our talented associates have a wealth of engineering, design, manufacturing, and service expertise to support your needs. We are dedicated to delivering exceptional solutions from custom to stock products, and we are conveniently located in multiple locations across the country to provide solutions and support when and where you need it. There is no better time to partner with Raypak.
So pool operators, I wanted to make sure they had understood about, normal chlorine levels, like Florida for public pools is 1 to 10. So if you kept a 10 ppm of chlorine in your pool all the time, that's not actually going to kill crypto, correct, Michelle?
It will kill crypto, but it'll take it much longer. So when we're saying do it at 20 parts per million for almost 13 hours, if we're going to cut that down to 10 parts per million, we're now talking about 25 hours or so. We're going to have to double that time because we're cutting the concentration in half. So therefore, we're going to have to double up on the time.
So it gives more time that if anybody goes into that swimming pool after somebody that was positive, they could get sick. And that's the reason why we make the chlorine level higher.
Exactly. And what we have seen in outbreak investigations is that parasite, Cryptosporidium, it really hangs out in the water. So if someone has a diarrheal incident in the water on Monday, we see people becoming infected or sick Tuesday, Wednesday. So, they're getting infected and then subsequently getting sick, after swimming just a day after, 2 days after, even 3 days after, someone's had an incident in the water.
And crypto is our most common recreational water illness that you guys document outbreaks for in treated water?
Yeah, so Cryptosporidium is the leading cause of outbreaks associated with treated recreational water and just all recreational water in general. And that's because crypto has figured out a way to get past our primary barrier, or the primary way that we stop infections from spreading in the water we swim in, and that's chlorine.
I guess it's learning.
Exactly.
So how is it, people might like to know, how is it diagnosed in a person, and for those pool operators that might not know that?
Okay, so what you do is if you're sick with diarrhea, you go to your doctor, your nurse practitioner, your PA, whoever, or urgent care, and when you're there, you report your symptoms, and they test your poop to look and see what's there. They might be looking for the DNA in there. They might be looking for the actual oocyst. It depends on the test. The proteins in the poop, and just once you get a positive, you report that back to the patient. And our big message to healthcare providers, to doctors, to nurses, to physicians assistants, is to remind swimmers to stay out of the water while they're sick with diarrhea. And if they've been diagnosed with crypto, they should actually be staying out for the 2 weeks, also the 2 weeks after their symptoms have completely stopped. Because we're still, when we're infected with Cryptosporidium, we're still shedding those oocysts for those couple of weeks. And I'm saying symptoms completely stop because sometimes when we're infected with Cryptosporidium, the symptoms come and go. So we might actually go to the pool thinking we're feeling better, and then the next day be sick again. And it's just our body hasn't cleared the infection yet.
And that's the hardest part with Cryptosporidium, I think, and people understanding once they've tested positive that they could be feeling better, but they need to stay out of the water. I think working at the health agency, that was the hardest thing to get people to understand. They would ask about it, when we would do our interviews, and I'm like, you don't want other people to feel like what you just felt like, and it could happen if they go in the water.
Yeah, exactly. We share the water we swim in. And so, we need to be doing our best to bring as few germs as possible into the water. And for Cryptosporidium, that means not swimming with diarrhea. For other germs, it's taking a shower before you get into the water. It's about, not peeing in the water you swim in. When we pee in the water we swim in, we cause two problems. One, we use up the chlorine that would otherwise be killing germs. And two, we're actually causing people's eyes to turn red. That's actually what causes people's eyes to get red in pools. It's our pee, it's our sweat mixed up with urine. And it's not the chlorine itself. So if your eyes are red, or if that pool has a quote unquote chlorine smell, that smell isn't actually chlorines, it's chloramines, the urine and the sweat and whatnot mixed with the chlorine. And that's what's making the eyes red, not the chlorine. And a chlorinated pool should not have a chemical smell. If it has a chemical smell, then you know there's something wrong with the way it's being operated.
And they need to shut it down and do probably something like breakpoint chlorination.
Exactly.
Who is at most risk of illness with crypto?
When I think crypto, I think young kids. They're most likely to drink the water they swim in, whether it's because they're learning how to swim or whatnot. They're also the ones that we hear about most frequently being infected with Cryptosporidium. And again, when our health departments are looking for cases of diarrhea caused by Cryptosporidium, they're looking at it based on symptoms. And our young kids are most likely to have symptoms because they're most likely to be infected the first time. So they're most likely to be picked up in tracking systems our health departments have. So it's really about, making sure these kiddos, stay out of the water when they're sick with diarrhea and, trying to minimize the amount of water they're swallowing.
Exactly. And what are the most likely places that an outbreak might occur in your experience for crypto?
We see a lot of outbreaks associated with water playgrounds or splash decks or spray parks, different names, but the same thing, the water shooting out of the concrete. We see kids sitting on jets, and kind of rinsing off their behind, unfortunately, that water being recycled, and then, unfortunately, drinking that water. I think they do serve a little bit like water fountains in a lot of ways, or drinking water fountains, unfortunately. Wading pools, the water's pretty shallow for the kiddos. And so I think the issue there is you have a much more smaller volume of water, but you're not releasing less oocysts into the water. So there's a higher concentration of the Cryptosporidium, that life stage that's going to cause infections. So we see a lot of outbreaks associated, where young kids go swimming.
And that's our biggest worry. So any of the pool operators that are really in those type of facilities, that's where they may get an outbreak there and have a higher statistical, more likelihood.
And these little kids are more susceptible. If they have a bad case of diarrhea or they have diarrhea lasting for days, it's going to be potentially a bigger issue for them. They're more likely to become dehydrated. And so, we need to be more careful with our kids and swimming. Healthy swimming is really important for the little ones.
So is crypto mainly spread by people, or can animals spread it in recreational water? And are there any documented outbreaks of animals spreading crypto to people in recreational water?
So when we're talking about crypto, we used to be talking about what we thought was one type of Cryptosporidium. We thought that. Now we know with DNA fingerprinting that there are over 40 different types of Cryptosporidium. So when we look at our cases across the country, across a given year, we see that there's two types of Cryptosporidium that we mostly see. One is what we call Cryptosporidium parvum, and we see that in animals. We see that one in spring. We see that one in rural areas. So with calves, in the Midwest or the northern Midwest, that's what I think about Cryptosporidium parvum. Then there's the other Cryptosporidium hominis, and this is the one that spreads more, not so much between animals and people, but between people. And this is one we see in the summer. We see this more in urban and suburban settings, and this is the one that causes most of the outbreaks when we're talking about pools, hot tubs, and water playgrounds. That being said, when I think about animals and pools and potentially spreading Cryptosporidium, I'm thinking more water that isn't treated with chlorine. So our lakes, our rivers. So there have been issues in those kinds of settings with potentially, animals using the water and then humans using the water and the humans becoming sick with Cryptosporidium. But when I think pools, I'm thinking people and young kids spreading it amongst themselves.
I know the big animal that we always get asked about all the time is birds, because you can't really control birds coming into your pool area, because they can, if it's an outdoor pool, they can just fly right in over the fence, and they poop all over the deck. They go in the water, they poop in the water. So is there a worry with birds, maybe specifically with Cryptosporidium and swimming pools and hot tubs or anything like that?
So the Cryptosporidium that infects birds doesn't really infect humans. If they were to swallow Cryptosporidium parvum, it's not going to infect them. There just isn't that human connection there. I'm not worried. I'm not so worried about the Cryptosporidium they carry and causing infection in humans.
And is there
we haven't seen that.
Is there any documented outbreaks with birds and crypto? Because I'm asking birds because that's like the one people always ask, like how to keep them out of the pool, because they're all worried about people getting sick from the pool after the birds were in the water. And they can control more with fencing other types of animals a little bit easier. The birds are the hard ones. So that's why I get questions about that all the time.
Yeah, we definitely want to make sure we take steps that don't encourage birds to hang out at our pool. So that might be managing, the bushes in the pool area better, working with animal control to keep them out, encouraging them to go somewhere else, whatever the case might be. I'm more worried about what the birds do to the surfaces around the pool and getting infected that way, as opposed to what they're bringing in the pool. Because most of what the birds have is pretty that can be spread to humans is pretty susceptible to chlorine. So I'm not so much worried about the water itself. I'm worried about the surfaces around the pool in that case.
Now, if there was they deposited crypto on the deck, if person goes into the pool, the chlorine pretty much is going to take care of that then?
For most pathogens, yes. And when we're talking specifically about Cryptosporidium, I'm not worried about what they're carrying versus what the swimmers are going to swallow and become sick with.
In my understanding, there is no is there any documented outbreaks of Cryptosporidium with birds in swimming pools or anything like that?
I'm not aware of any.
Gotcha. So it sounds like it's mostly a human to human thing we're spreading here in our recreational.
When we're talking pools,
yes,
definitely. When we're talking pools, it's really more about human to human, and maybe when we're talking about lakes, we can start talking about mixing of humans and animals, and then possibly spreading Cryptosporidium. So
the diarrheal fecal guidelines that are on the healthyswimming.org, is that the website, Michelle? Healthyswimming.org?
That works as well, or cdc.gov/healthyswimming, one word.
There we go. And they can find the fecal incident guidelines from the CDC there, our pool operators, correct?
Correct. And their guidance separately for, if your pool has cyanuric acid in it or not. Before we talked about, raising the chlorine to 20 parts per million for 12.75 hours. If we have cyanuric acid in the water, then we're really talking about getting the concentration of the cyanuric acid down to 15 parts per million or less. So that might involve draining of the pool, and then raising the free chlorine level to 20 parts per million for 28 hours. So that's going to make a big difference, because remember, when we add cyanuric acid to the water, we're trying to protect it from the sun, but at the same time, we're slowing down the disinfection rate.
Exactly. And I was going to bring that up. So thank you so much. And that's specifically for diarrheal incidents, correct?
Correct. So the 20 parts per million for 28 hours is if we have cyanuric acid in the water, and if we suspect there's an outbreak linked to the pool, or if there's been a diarrheal incident in the water.
So if it's a solid stool incident and no outbreak linked to anything, they would still just follow the 2 part per million for 25 to 30 minutes per CDC guidelines for a solid stool incident?
Yes, for form stool incident, we don't have a separate incident. We don't have separate recommendations for pools with cyanuric acid and those without.
Yeah, and animals. People ask about animals just because they worry about what they spread, and I know we talked about that already. But when it comes to the fecal guidelines, what's your guidance on that when animals are in the pool?
I'm sorry, I didn't understand that question. If you want to repeat it or...
Okay. When I know some of our pool operators always ask, well, if there's been an animal in the pool, what do I do? What is the CDC guidelines if an animal's been in the pool water? How do I treat it?
So that's going to depend. Most of the time, the recommendations are going to be, treat it like a form stool incident if there's been an animal in the water. If we're going to talk about, and I don't think this has been an issue, but if you talked about a cow getting into a pool, I think then we can start talking about, the hyperchlorination guidance, the either 20 parts per million for the 12.75 hours or 20 parts per million for 28 hours, depending upon, if you have cyanuric acid in the water. All that is explicitly talked about on the Healthy Swimming website. I have gotten questions about snakes in the water, other animals in the water, and basically the answer has been, follow the formed stool response recommendations. We did add a caveat that if it's a cow in the water in the pool, then you're going to treat that differently. I have not gotten that question yet. So
I have a picture of a cow in a pool, though.
Oh, okay.
Somewhere. So I guess they should treat that one in that instance as a diarrheal incident with cyanuric acid in it. I've even got a picture of a horse in a pool and a giraffe and I think and a hippopotamus. It's amazing what you find on social media, right?
Seriously.
I should share some of those with you, Michelle.
Oh, I'd love to see them. Or maybe not.
So is there any other guidance being from the CDC about crypto for our pool operators or any new information that, is new that we haven't heard about crypto or in regards to aquatic facilities?
So we are working on finalizing and publishing data on the use of chlorine dioxide in response to Cryptosporidium in the pool. We do have one publication, and it shows, chlorine dioxide, added to the water could after, a diarrheal incident or after, you're in response to at least suspecting an outbreak caused by Cryptosporidium. I mean, when we're talking about that, we're talking about really cutting down the time if we're using chlorine dioxide. However, it's up to EPA whether or not that can be used in the pool, and that's still being that's still under discussion. We can also use, better filtration. I mean, I think we've been using the same kind of filtration, sand in a can to a big extent. Taking our filtration to the next level, whether it's using coatings on the filter in the media, or starting to look at using coagulants in the water or flocculants in the water. And basically, what that means is putting chemicals in the water that pick up all the debris in the water that's really too small. Yep. And will go through the filter. So seeing how that works, the data that have come out on that have said you really need to follow the manufacturer's direction to make it work properly. So I think that's something that's on the horizon that needs to evolve a bit more. We're also working on updating our model aquatic health code, and we'll have that out later this year. And that talks about using UV and ozone as added
I was going to
layers of protection.
That. Yes.
Yeah.
I was going to ask about that.
So UV and ozone are very effective about, when it comes to inactivating or killing Cryptosporidium. And the MAC talks about, when we're talking about high-risk venues, these venues used by kids who are very likely to have Cryptosporidium, using it in the water playgrounds, using it in the kiddie wading pools, and holding those to actually, when we're talking about our water playgrounds, the splash pads, the wet decks, holding that UV and ozone to a higher standard, and in that venue in particular, because we have seen so many crypto outbreaks. I believe it's a 3 log or 99.9% inactivation, where for other venues that aren't water playgrounds, that aren't spray pads, just a 2 log inactivation or 99% inactivation of Cryptosporidium.
And you got it right on. I was going to ask about like secondary disinfection as another thing. So you're still using your chlorine, and then you got secondary disinfection, UV or ozone. I know that the health department in Florida added that for splash pads. At least they required any new splash pad, and I think the last, I don't know how many years it's been now, that they have to have a secondary disinfection system. So, and it's that high risk aquatic venue right there that you're talking about. Well, it's been wonderful talking about crypto. So I think we're going to transition right into Legionella, which is another wonderful organism. It's not related to crypto at all. Crypto is a protozoan parasite, right, Michelle?
Yes, ma'am.
And Chris, Legionella is a bacteria. So we're going to be transitioning from a protozoan parasite right into a bacteria here. So Chris, what is Legionella and what's so unique about it?
Yeah, absolutely. So Legionella, as you mentioned, is a gram-negative bacteria. It's pretty commonly found in the larger environment. So in freshwater ponds, kind of anywhere you see stagnant water, you can find Legionella bacteria. But the trick is the Legionella bacteria concentrations you find in the environment are typically not high enough to really cause any kind of risk. You don't typically see cases of Legionnaire's disease for people swimming in a lake or a pond or something like that, even if the bacteria is present. The interesting thing about Legionella, compared to a lot of bugs, is it's really not a person-to-person transmission. It's not the kind of bug you're going to get from somebody who is sick. It's not the kind of bug you're going to get from being near somebody, being in the same room as somebody, even if they have, a quite severe case of Legionnaire's disease, which is one of the diseases that Legionella bacteria. It's really a premise plumbing organism. It's really a built environment. And so unlike crypto and some of the other bugs, the prevention is really on the owner and operator. It's unique in that you get it from water, get it from breathing in kind of mist, has Legionella bacteria in it, and you get it when the water is not being properly maintained. It's a bug that likes warm temperatures, so its ideal growth range, unlike a lot of organisms, is quite hot. So something like 77 to 110, 112 degrees Fahrenheit is the ideal growth range for Legionella, which unfortunately is, right in the sweet spot of something like a whirlpool spa or hot tub.
Exactly. Which they like to keep 98 to, should be 98 to usually like 104, but I've seen it bumped up to 109. So still in that range.
Absolutely. And that's one of the risk factors associated with something like a hot tub when it comes to Legionella bacteria. Because really, to prevent the bacteria from growing, you want to keep the water either cold, so below 77 degrees, or hot, so, above 120 is typically what we recommend. So when you have a device like a hot tub where your standard operating temperature is right in the growth range, you really have to be quite careful with your biocides, so your chlorine levels, your pH levels, and the overall cleanliness of your system.
And what makes it spread more? Where is biofilm in the lines? All these different things come into play with Legionella being present in the hot tub or spa?
Yeah, so hot tubs present a few risk factors. The first, as you said, is the growth. So they have usually relatively complex plumbing. So lots of pipes, some pipes with small diameters. You can have pipes with kind of slow flow, which is another way the bacteria can kind of get a good stagnant point system where the water's not moving very fast. It's not something you can really completely prevent from getting into the system. There is, as I mentioned, Legionella in the larger environment. It's not something that is rare in the larger environment. It's not something that is completely unheard of finding in the municipal water system. And that's why it's so important for pool owners and operators to do a really good job maintaining their devices. Because once the Legionella bacteria gets into something like a hot tub, if your chlorine levels are not where they need to be, if your pH is out of range, if you have too high of a bather load, and so your chlorine isn't adequately maintaining your residual level of disinfectant, then you can get pretty rapid growth of the bacteria. And then the other fun thing about hot tubs is once that growth happens, you have a lot of aerosolizing devices. So to get the bacteria, you typically would not get it from a completely stagnant pool of water. If there's no splashing, if there's no misting, you really need to breathe that mist deep into your lungs to be at the highest risk of infection. And hot tubs hopefully have jets and other types of devices.
I'm going to go turn that 15-minute timer on, and I'm going to go sit and relax. Now,
sit and relax.
Now, my understanding is if you're downwind from the mist, it's possible that you don't even have to be in the spa to breathe in the mist with the bacteria in it from that contaminated spa and still contract Legionella?
That's absolutely correct. We've definitely had outbreaks where people who got sick never reported getting in the hot tub. They just would walk by the aquatic center, or maybe the hot tub was located in a particular part of something like a hotel where, get in and out of the building, you had to walk in the general vicinity of it. We've also, I think we published a paper on this a year or two ago, had a really interesting outbreak at a horse racing facility that had a hot tub for the jockeys. And it just so happened that the building was designed so that one of the air intakes for the larger HVAC system of the building was in the room with the hot tub. And so our suspicion based on the epidemiology is that hot tub had Legionella in it. It was pulled into the larger system, and actually people on a different floor of the building who never even went on the same floor as the hot tub came down with Legionella. So that mist can really travel, especially if there's a high concentration.
That's an interesting outbreak there. That must have been, it was related to an aquatic venue, but then turned into, and it shows how things with public health can start one way and can spread other ways. And sometimes those that do not work in public health, they think it's just one route. And it's like, it can go in other directions other than just a waterborne illness. I know Michelle would agree with me, just going back to crypto for a minute. Crypto, we had an outbreak with a splash pad that I worked on in 2007, which I think you even had in a presentation years ago down in Indian River County. And we had 33 confirmed cases. And we know that it was also being spread through a childcare center. So now it's
yes.
Yeah, it wasn't even recreational water at that point. Now it was horrible, not good practices on the part of the childcare center that we observed with hand washing and not disinfecting, mats, where they were diaper changing and letting children come in sick with diarrhea, not making sure they stayed home, and lots of factors that came in. So listeners, when these outbreaks start in aquatic facilities, specifically with crypto, just going back to that for a minute, it can actually spread in other ways. You agree with me, Michelle? So you got to take it seriously that it doesn't just stay one way.
Yeah, definitely. And the thing about crypto is we see crypto getting into other pools if there is an outbreak in the community. Again, it's not necessarily bad operation or management, right? Because it can get past that barrier of chlorine. And who's swimming in these pools? It's young kids, and then they bring it to daycare. And what is the primary barrier in daycare for spread to prevent the spread of germs? It's bleach, which is chlorine solution. So we definitely see community-wide outbreaks that impact thousands that start at one pool, go to multiple pools, and then get into the daycares.
Yep. And I wanted to bring that in because Chris kind of hit on it, and I've forgotten to bring that up earlier. So thank you very much. That was good, Chris. And that was I didn't realize that or even think about Legionella though. Like crypto, I think about it being like going in other directions, but Legionella, I didn't really realize or think about an indoor spa, which maybe there's an HVAC system in there pulling in air that's going to go to a different floor of a building. That's interesting.
Yeah, it's definitely the kind of situation where you might not know you've been exposed. And so sometimes it's very obvious that you're walking by something like a hot tub, but sometimes it's not. And so that's just, one more point that builder, owner, and operators need to think about when they're ensuring that their water system is properly maintained.
So let's summarize for our pool operators really quick for Legionella. What are the conditions that make it ideal for that hot tub or spa to create a Legionella outbreak? Let's just summarize it all in one nice little list for them.
Absolutely. So the first is temperature. So as I mentioned, Legionella grows preferentially between about 77 Fahrenheit and around 110, 112 Fahrenheit. So if your water is in that growth range, you're already at high risk. So it's one of the reasons we don't typically see Legionella growing at large quantities in something like a pool, because generally the water is of a lower temperature. Now, if you have an outdoor pool, especially in the South, where it certainly gets above 77 degrees, if that pool has relatively stagnant water, you can see kind of localized areas where you have something like hot water, water that's hotter than you would suspect in a pool, which is another reason we move to the second item, which if you can't maintain your Legionella control purely based on temperature, you have to maintain it based on biocide. So unlike something like crypto, Legionella, at least free-floating bacteria, is readily killable by free. So it does a really good job killing it. It kills it quickly. The interesting and difficult thing about Legionella, I think you mentioned it in the intro, is that it can form biofilms. So for the listeners that don't know, a biofilm is basically kind of the gunk that can grow over time on the sides of jets within the water system in kind of slow-moving parts of a hot tub's water system. And once Legionella kind of enters a biofilm state, then it gets really difficult to kill because those kind of gunky areas, it's difficult for the chlorine to penetrate it. And getting rid of biofilm really requires kind of manual labor. It's, draining a pool, scrubbing the jets, putting some friction into those biofilms and really getting them clean. And then the last thing is pH. So if your pH is totally out of control, your chlorine's not going to be as effective. And so if you are not properly maintaining your pH in a water system, even if you think you're maintaining your chlorine levels, it may be at a level that is not going to be efficacious at actually killing the Legionella. So the way we like to think about it is, keep your water cool or hot, keep your water clean with biocide, and then keep your water moving to prevent.
And now I'm going to have to cut this out because I was about to ask something and I forgot what it was going to be. Oh, golly, what was I going to ask? I think I was going to ask what chlorine level would kill it that's effective. And then I was going to ask about the jets aren't always on. So that's where those lines are stagnant. So that's where I'm going to go with this in a minute.
Okay.
So the lines are stagnant and chlorine level. Sometimes your brain just stops. All right. This is where I'll come back in. So what chlorine level would be effective at killing Legionella and so that's not present in the water of the hot tub or spa?
So it's pretty similar to other bugs. It's, the standard pool and spa chlorine levels that are recommended in the Model Aquatic Health Code and are required in most municipalities. I think on our website, we recommend between like 3 and 10 parts per million. But as I said, in its free-flowing state, it's quite susceptible. And so when we're doing kind of an outbreak investigation, if we're seeing detectable chlorine, that's good. And then obviously the higher, the better. I think on our website, we recommend between kind of 3 and 10 parts per million. But following whatever your local pool and spa recommendations and requirements are, should be adequate to control Legionella if you're adequately monitoring your bather load and you're adequately monitoring other factors such as pH.
So like I know Florida, they have a chlorine level minimum of 2 ppm in a hot tub or spa for public pool level. Is if they maintain all the other factors you talked about and they maintain, say, their chlorine at the minimum of a 2, would that be effective at maintaining the spa without Legionella being spread?
That should be effective. That should be effective at preventing the growth and spread of Legionella. One trick is, how that monitoring is performed. So, if you have an automatic feeder system, you likely have better, hour-to-hour control of your bacteria than if you're kind of throwing in tablets or using hand-fed systems. And so that's something to think about too, that, your monitoring is only as good as how often you monitor and how good your records are. And then also, what else you're seeing in the system. Legionella is not the world's most common respiratory disease. Something like crypto, as we mentioned earlier, is much more common. E. coli is I think, probably a high risk factor too. And so if you're seeing those other types of detections, if you're seeing evidence that a system's not being well maintained through detection of other organisms, then you may have a Legionella problem as well. It's the kind of bug that if you let it get into the system and if you let it get growing, it can be pretty difficult to remove without, some pretty radical remediation activities.
And we're probably going to find it more likely maybe in the spa jet lines than we would maybe in the regular returns that are constantly feeding back to the spa, because those lines tend to be sometimes stagnant, I would say, because if nobody's using the spa, you're not turning the jets on. So the lines are not really spitting out water and aerosolization of the water and that kind of thing.
Yeah, stagnation has a couple factors. First, it can alter the water temperature. So, maybe the water in those lines is not being maintained at the precise water temperature you expect the larger spa system to have. And then also your chlorine gets eaten up. As the water sits there, as it encounters bacteria or fecal matter or urine or sweat or basically anything that you can encounter in a spa environment, the chlorines get eaten up. And if the water's not circulating, if fresh chlorine and fresh biocide aren't getting into those kind of nooks and crannies and piping, as you mentioned, that are in kind of the jets. So, when we're looking for biofilm, the jets are, definitely one of the places. That's not to say that you can't find Legionella in, kind of a bulk water sample, especially if you have a spa that's particularly not well maintained. But that is the part of the system that's probably the hardest to get at. And so that's one of the reasons it's important to make sure your system is properly circulating so that fresh, chlorinated water is kind of being pushed through all of the parts of the system, even when no one's using it.
And I think that very much hit home when the CDC came out with their recommendations after COVID. And we know a lot of our spa and hot tub facilities were closed during COVID. You guys came out with your guidelines for reopening a hot tub or spa, and it really hit home on a lot of these factors that would increase the chances of Legionella, I believe, correct?
Absolutely, especially with a hot tub or a spa that's been shut down for a prolonged period of time but not drained. That's a high risk situation. So that's a situation where, just throwing in a couple chlorine tabs and measuring your remaining biocide might not be enough to ensure that the system is truly free of Legionella. We know that, water that sits around, especially water that's sitting around at kind of an elevated temperature, that's just the ideal situation for growing Legionella bacteria.
So for those of us that don't know, how does a person become diagnosed with Legionella? So, the health department finds out about it and then they're going to, do an outbreak investigation or whatever. But how does that initial diagnosis happen? And why are we seeing more? It seems to me, and I think to others have asked me, it seems like we're seeing more people diagnosed with Legionella now than we had maybe even 10, 15 years ago.
Yeah, we absolutely are. So we've seen increases in the reported number of cases of Legionnaire's disease over the last 10, 15 years. It's been, kind of a steady increase up to in 2018, we had the most cases ever reported. It was over 10,000 nationally. In 2019, it went down a little bit. It was about 9,000, but that's still quite a bit higher than you saw even 5 or 10 years ago. Diagnosing Legionnaire's disease is pretty simple. So almost all health departments and hospital systems have the tools necessary to diagnose the disease. There's a few different test types. By far, the most common is known as the urinary antigen test. So this is a test that it's run by a health provider. It's the equivalent of kind of a pregnancy test. So you dip the strip in urine. You get 1 line or 2 lines. It's very simple. It's highly accurate. It's highly sensitive and specific, particularly and specifically for the most common type of Legionella bacteria that infects people. So much like crypto, there's, I think, over 60 different kinds of Legionella bacteria out there. Not all of them cause disease in humans, but a fair number of them do. The overwhelming majority of human cases of disease are caused by Legionella pneumophila serogroup 1, which is just one particular serogroup of a larger family of Legionella bacteria, and that's the particular strain that is detected by the urine antigen. The other way to diagnose it, and what we strongly recommend whenever a doctor is ordering tests when they suspect a Legionella infection, is a lower respiratory culture. So that's when you kind of produce a phlegm, when you've got something it feels like down in your chest and you kind of cough it out. That material can be cultured, and that is another way to identify a Legionella infection. And the nice thing about that kind of testing is it can identify an infection from any of the species.
Nice.
So that can identify even the less commonly seen infections. And then the third way, which didn't really used to be a large number of diagnoses, but is becoming more and more popular, is there are now PCR genetic tests that can identify Legionella genetic material in a patient specimen. Those are relatively new and are kind of just coming on board in health systems. But that's another method for diagnosing disease.
But by far, majority are using the urine antigen test. And
yes.
From my experience, when I worked in epidemiology over at our local health department, was when we got the info, on a positive Legionella, it would be urine antigen positive. And then they also clinically had like pneumonia. The doctor did a chest x-ray or whatever and clinically stated this person pneumonia. So because my understanding is you could test positive in that urine antigen test from a previous, maybe in the last, we didn't even really know what the length of time really was, but you could have had Legionella prior, but not right now. So the doctors, or at least for us locally here, really would link the urine antigen test with an active right now pneumonia patient. And they would clinically say they're positive for Legionella at that point because they're clinically pneumonia, positive urinary antigen test. Is that kind of true?
So in general, we don't recommend even using the urine antigen test unless someone has symptoms consistent with Legionella. So we're talking shortness of breath, fever, feeling kind of sickly, feeling tired, and then Legionnaire's disease cases are also characterized by that clinical or radiographic, so X-ray or CT pneumonia. While you can test positive on a urinary antigen test kind of for a time period after your initial illness, it's normally not too long unless you have some sort of an immune or kidney condition. In those kind of rare cases, you can see those urine tests be positive for a prolonged period of time. And that's one of the reasons we recommend not using that assay unless someone has a new onset illness. That's when someone is sick with symptoms consistent with Legionnaire's disease and receive that test, it is extremely sensitive and specific. So when we see somebody who's sick and has a positive urinary antigen test, we feel quite confident that that's kind of an active Legionella infection.
Who's in the population, who's at most risk of contracting or getting Legionella?
So it's people with, slightly or moderately weakened immune systems generally. So anybody over 50, former smokers, because it is a respiratory disease, anybody with an immunocompromising condition, HIV, some sort of kidney or liver disease, solid organ transplant, cancer. So, anybody who has, a not fully, immune system firing on all cylinders is at increased risk. And the elderly is where we see most of our cases.
In general, how long does the symptoms that you mentioned earlier for Legionella, how long do they last? I know it's going to range from person to person with all the different conditions you just listed, but what's the average?
So the incubation period, so the time between being exposed to the bacteria and having symptoms, typically lasts between 2 and 14 days. So it can have an incubation period that can make it difficult to identify a source. So if, for example, you go on vacation and you stay at a hotel with a hot tub, and then you leave, and 10 days later, you start to feel ill, that's totally consistent with an exposure to Legionella bacteria. And it's one of the reasons we rely on our local, state, and federal public health authorities to kind of identify these cases and put 2 and 2 together to ensure that those kinds of sources can be remediated. I will say, I didn't mention at the top, but Legionella bacteria can actually cause 2 conditions. So Legionnaire's disease is the most widely known. It's the one that causes a pretty severe pneumonia. It has a mortality rate, at 8, 9, 10%. So it's quite serious if you get it. The other condition is known as Pontiac fever. So that's much less serious. It's, a self-limiting illness. You get better on your own. The incubation period is quite short. You typically start feeling ill within 24 hours of an exposure. It's flu-like symptoms, so it's not associated with pneumonia. It's typically associated with kind of a little cough, feeling kind of run down. You typically get better very quickly. And so Legionnaire's disease is the one we focus the most on because it's the one that is the most deadly, and it's the hottest.
So if local health department contacts an aquatic venue and they talk to the pool operator and they know, we've had a Legionella, positive Legionella, what steps should that pool operator take once they know that there was a positive Legionella in their aquatic venue?
Yeah. So first off, we recommend, and just as you said, that those pool owner and operators work really closely with the public health department that are investigating the illnesses. We recommend that they, stop the use of the device. So stop the use of the hot tub, turn off any jets associated with the hot tub to prevent any further aerosolization. If the hot tub is, in an aquatic center or some area that can be kind of segregated from the rest of the facility to ensure that kind of nobody goes in it while the investigation takes place. And the really important thing for the identification of a source is that they don't drain the hot tub. So some people think, I have this hot tub that might be a risk. I want to get the water out of it to make sure no one else can be infected. But if there's no aerosolization happening, so if the jets are off, if the water's totally still, it's really no longer a risk to the guests at any kind of an appreciable level. But ensuring that water stays in the tub is the best way to make sure that public health can do their sampling and to do an environmental investigation, really identify what the potential source could be. Because we know in lots of venues like hotels, there might be other potentially aerosolizing devices outside of a hot tub, such as a fountain or something like that. And so, making sure that those devices kind of stay in the state they were in when the person may have been exposed is the best way to ensure that public health, along with the owner and operators, can properly investigate the.
So we talked about secondary disinfection with crypto. Would secondary disinfection be something that would be really useful to have on a hot tub or spa? So they have a main chlorinating system. And if they had a secondary UV or ozone system that kind of fills in the gap and helps the chlorine, do you feel that would help reduce Legionella outbreaks in these commercial hot tubs and spas, or?
So I'll admit I'm not an environmental health engineer. I'm an epi, so I can't really speak to the secondary systems. I will say, unlike with crypto and some other bugs, the primary free chlorine disinfectant is quite effective at killing Legionella. So not to say that those systems might or might not be useful in certain scenarios. But a really well-maintained hot tub that has appropriate residuals, that's being cleaned regularly per the manufacturer's instructions or the local public health authority rules and regulations, should be at relatively low risk for growing and spreading Legionella.
So it sounds like compared to crypto, which is harder to kill, Legionella is pretty susceptible to chlorine. So it's coming down to, it sounds like, more about the main things that they have and that we talked about earlier with Legionella and maintaining all those conditions. So from what I heard, pool operators should maintain good disinfectant levels at their minimums at all times, most likely using a automatic chemical feeder so they can maintain levels and not have dips and valleys in their disinfection where it might allow Legionella to grow at those points. Make sure you don't have biofilm buildup. And what else? What else am I missing in this list for our pool operators, Chris?
That's pretty much it. The only other thing I would add to that is, be cognizant of how often the device is used. So if you have on and off seasons, like a lot of recreational activities and recreational venues do, ensure that when it's in the off season, the device is either completely drained or you're maintaining that residual the entire time. That, you don't turn it off, when there's really not a particularly high load, because even if you turn it back on at a later date and think you're going to add chlorine and get yourself back up to your minimum, that's the exact scenario where you can get the growth of a biofilm, which then throws you into a much more difficult cleaning situation than if you're properly maintaining your system for the entire duration.
And is there any new information about Legionella or anything like to bring up? So kind of cool, or it affects our pool operators? Anything new on the horizon?
Just that, as you said earlier in the podcast, Legionella is on the rise. So the cases in the U.S. have been increasing for years. The number of reported outbreaks have been increasing for years. We think there's probably a lot of reasons for that. One is the U.S. population is getting older. So, as the population gets older, your number of people who are potentially susceptible goes up. Second, the built environment and these devices get older every day, and they get harder to maintain. We all know that a brand new hot tub or spa is easier to maintain than one that's been running for 5, 10, or 15 years. And so as the plumbing gets older, as the device gets older, it's not operating often at peak performance. And so it gets more difficult to maintain. So that's something to be aware of as well, that as the device ages, you might have to be even more careful about ensuring that it's cleaned regularly, that your biocide levels are appropriate, that you don't have some sort of stagnation point that wasn't obvious when it was younger and running more.
And I think that's an important piece right there, because you're correct. They do age. And then you got some of the public swimming pools in some states are like homeowners associations and condo owners associations, and they don't feel that something is important enough to fix or repair or put the money into it. So you got pool aquatic professionals trying to maintain something that they really can't maintain properly unless that organization that association would put the money into fixing it. So I think for the listeners, that overall, if they could maintain that spa, even though it's aged, maintain it up to current standards, and the older it gets, you got to spend more time on it. You're going to reduce the likelihood and follow everything we've talked about, reduce the likelihood of having a Legionella outbreak in their facility.
Absolutely. Legionella just has to be on the minds of folks who run these devices. Unfortunately, it's not the kind of system where you can just make sure the water is really cold and then, check your biocide every once in a while to ensure that you're within a recommended range. With something like a hot tub or a spa, really the vigilance of the owner and operator and of, any consultants or any groups that are hired in to help manage that system are of the utmost importance. I mentioned earlier, it's not a person-to-person disease. This is a built environment disease. Get Legionella growth when a system is not properly maintained, and then you get disease when a person is exposed to a system that's not properly maintained.
And that's really cool that we've talked about two different organisms that completely are different from each other, spread totally differently, really totally different venues in some ways, and their uniqueness. So it's been really cool to talk with you guys today about these two organisms and hopefully bring some good information to our pool operators, educate them, especially straight from the CDC. So I appreciate you guys taking your time today to be on my podcast. And do you guys have any final thoughts for our pool operators?
To learn more about healthy swimming, go to cdc.gov/healthy swimming, one word.
Yeah, and with regards to Legionella, I think one thing to think about for pool owner and operators is they might just be one device in a larger building water system. So ensuring that they work with the other entities within their building to ensure that the entire building's water system is being properly maintained, because we know that water systems are interconnected. One issue somewhere else may impact something like a hot tub or a spa in ways that won't be obvious. I mentioned the HVAC system previously. So ensuring that those owner operators aren't operating in a vacuum, that they're working with the other folks within their building to ensure that the entire water system is being managed appropriately. And if you want more information about Legionella, including recommendations for operation, what to do if there's a case, who's susceptible, lots of information is available on our website at cdc.gov/Legionella.
Thank you so much for being on my podcast today, guys.
Thank you for having me.
And thanks for helping spread the message about healthy swimming. And, healthy swimming is really a partnership between our health departments and our pool operators. And together we can prevent these outbreaks caused by Cryptosporidium and Legionella and learn from each other and really promote healthy swimming.
And that was my whole goal with you guys being on the podcast today. So thank you so much.
Absolutely.
Thanks for diving in today with the Let's Talk About Pools podcast. Be sure to follow us on our YouTube channel or our Facebook page. And feel free to rate, subscribe, and leave a review wherever you listen to your podcasts so more aquatic professionals like you can learn about the show. We appreciate it, and we'll catch you in the next episode of the Let's Talk About Pools podcast.